Hi, my name's Matt. I work for the British Red Cross. The Red Cross has got a long and storied history with data. Does anyone know who drew this, the first radial chart? Florence Nightingale, yes. And in the 1850s, she was a nurse during the Crimean War. She was one of the people responsible for professionalizing nursing. And then some years later, she drew this. Some years later, she also helped found the British Red Cross, giving a lot of advice about working in hospitals and providing healthcare in the UK in the 1870s before the NHS existed. And we carry on a lot of her legacy today. We're most famous for working internationally, providing support in international humanitarian crises. But we do a lot of work in the UK where we're aiming to help everybody get the help they need in a crisis. And we do that across three broad areas. One is disasters and emergencies. In the UK, this takes the form mostly of emergency responses during things like floods and house fires, gas outages, increasingly heat waves and wildfires and other climate change-related extreme weather. We're also moving more and more into doing resilience building for people and communities who are most at risk of these emergencies. We provide humanitarian education and first aid education, and we're doing more and more work around climate adaptation. The second big area that we work in is health inequalities. We provide a range of services that are ultimately all about stopping people falling through gaps in the health and care system in the UK and improving patient flow within hospitals and out of hospitals. So our services range from helping people get home when they're clinically fit to get home but otherwise might not have a care package in place, supporting people at home to live independently, doing some new work around virtual wards, what can be considered a hospital at home. So if you need some clinical support but you don't necessarily need it provided in a hospital, you can have technology at home and nursing at home, and we're providing more and more of those services. We help people who are frequent attenders of A&E and other kinds of emergency services. We do social prescribing, and also we do patient transport, helping people get to and from healthcare appointments. And the third big area we work in, we're the UK's largest independent provider of support to refugees and people seeking asylum. And broadly, that work is about ensuring people have got access to protection, particularly with all the government's changes to the asylum system that we've been seeing in recent years, and then enabling people to have a safe place to live. And if they're in an unsafe situation, helping get them out of that unsafe situation, and preventing destitution. And particularly, this can happen when you get, hopefully, a positive grant of refugee status in the UK, but then you have a short amount of time in which to move out of your asylum accommodation, get a bank account, get a job, get a place to live. So we help manage that transition and help people integrate into the UK. And then finally, finding and reuniting with loved ones who you might have been separated from across the migration journey. So where does data come into that? Our colleague in Geneva, Caroline Holt, has said that she believes data is the new frontier of humanitarian work. It's the place where we contact and we're engaging with vulnerable populations, and it's the new way in which we're engaging with governments and with the bigger picture. It's absolutely vital to 21st century humanitarian aid. And the way that we do it in the UK at the British Red Cross is sort of in four broad areas for our on-the-ground work. We use data science and other forms of research to target our interventions based on evolving humanitarian need. So this is about trying to understand the potential scale of need across the three big areas that I mentioned and how that need might evolve in the future. We prioritize what works based on the outcomes and the impact that we're looking to have. So really trying to understand what our interventions are trying to do for people, and then making sure that we're doing more of them and less of stuff that doesn't work quite so well. We do a lot of data analysis to support the growth and the funding of our humanitarian programs, particularly working with, say, innovation teams who are trying out new ways of providing humanitarian aid, and then working with fundraisers to try and tug at the heartstrings using some nice data journalist kind of techniques. And we also have a lot of internal data that we capture. So for example, if we've got teams going to a house fire or taking somebody home from hospital, we'll be conducting needs assessments, we'll be doing situation reports. We have loads and loads of data. And so we have teams who are analysing all of that to inform our humanitarian action as well. And to support with this, over the last few years, we've been building a humanitarian data science framework that we are calling the Humaniverse, a universe of humanitarian R packages that are all about providing data and tools for helping us do this kind of work well. The QR code here hopefully takes you through to our GitHub org on that. And the principles behind this are we wanted to really work in the open, and I'll say a bit more about why in a couple of slides' time, but being open source, providing open data, using open data, providing open tools is really foundational to us. It also helps us code in collaboration with others. We've had people who have been providing data, providing tools, providing code to us, including two of our former data scientists who have moved on elsewhere, who are still active contributors to the Humaniverse suite of repos. And even a couple of months ago, we had our first stranger submit a pull request, which was really cool. Somebody we'd never heard of just said, here's some stuff, thank you, and it was brilliant. And we find for us, this really helps us speed up our development and analysis time. Like at heart, we're an emergency response organization, and we don't have the luxury of time most days. And so having this foundational suite of products that helps us do the kinds of analyses we need to do quicker is really, really vital for our work. But some of the dangers of doing work really, really quickly is that you might end up making a lot of mistakes. And so we wanted to make sure that by doing everything in the open and including building some of the web apps I'll show a little bit later in the open, it means that we can be reproducible and repeatable. Like in the field, when people go to disasters and are doing, say, information management during, say, an earthquake somewhere, often a lot of work is done in Excel spreadsheets. I was reading about some research on mistakes and errors in Excel spreadsheets, and some evidence says that it's like up to 94% of spreadsheets have got errors in them. That's not to say code doesn't have errors in it, but at least doing open code means your errors are there for everybody to see and they can correct you. It's not kind of hidden away and a bit obfuscated. And the way that we're trying to move the Humaniverse now is to help us have a set of standards and checks. So like Miles was just saying about having CI whenever you post something to their central repo, we've started running our command checks whenever we merge things into our main branches, and building out more test cases and doing different approaches like that. We're still at the very beginning stages of this, but it's really helping us try and understand where errors might be creeping into our own code base, especially as we rely more and more on it. And so for the rest of this talk, I'll give a few examples of the packages that we've built and how that we're using them in practice. Humanitarians love maps. And this maps have been used in humanitarian aid for a really long time. Like you might have come across the Human Development Index. It's been a long-standing way of trying to understand different kinds of needs at a global scale for, I can't even remember how many years, but I think some of the original sort of vulnerability mapping goes back to the 70s for humanitarian work. Our own journey for this started during the pandemic, and I realize I'm like the third of four speakers now to talk about the pandemic, so apologies for triggering that. But during the pandemic, and this is before the Humaniverse existed, but this was our first foray into doing open source working, we built a vulnerability index specific to COVID-19. And this was to help our teams respond like really rapidly as the situation was developing by essentially pulling together a whole bunch of data sets, doing some maths, and then ending up with a number. And when Colin said that speakers gloss over details, that is a prime example of glossing over details. But there's so many different ways to build composite indices. The OECD has a whole book on how to do this. You might have come across the Index for Multiple Deprivation that's produced for the UK and has been produced for like nearly a quarter of a century now. They've got their own methodology for doing it, which we used for this because it's really good for sort of going a bit more towards more vulnerable neighborhoods rather than other approaches which can average out some of the differences. But in essence, by working openly, we had a bunch of people at different universities coming to us saying, hey, we've got some data that we can share with you, or here's some code to help you calculate things like road distance to GP surgeries or road distance to post offices, back when there was a brief period where you could go to a post office and get cash out when you couldn't get cash out of anywhere else. And so by doing this openly, it meant that there was sort of like a power of nerdy kindness coming together and everybody working together to help us build this out within a period of months. And so that was our first kind of foray into composite indices. And now we use a lot of composite indices. We use other people's ones. We build our own at various points. So we've been using a flooding one, which is produced by an agency called Sayers & Co. Paul Sayers and his team work very closely with the government on doing our climate change risk assessments, and some of the leading experts in like modelling flood risk and flood vulnerability. And then inspired by that approach, the University of Manchester built a heat waves disadvantage map, which looks at places where people who might be more likely to experience a heat wave could be more vulnerable when a heat wave occurs. And then inspired by both of them, we have built a wildfires kind of risk resilience vulnerability map. And my former colleague, Matteo, is in the audience. He's been doing a lot of work helping us out on this. We also did it as a collaboration with some researchers at University College London, and taking a very similar approach to how these other two vulnerability indices were made. But as far as we're aware, this is the first time anyone's done this for wildfires. And these are just some examples of our weather-related composite indices. We use lots and lots of other ones. I will touch on some when I talk about health in a little bit. But because we use them a lot and because we make our own a fair bit, we're developing an R package and an R Shiny app to help build them easier. So this is a proper sneak preview. This is a hidden GitHub repo at the moment, apart from what the app is. This package is our compositor library, which we're just starting to build out now, which is a way of getting all the different kinds of tooling in order to make a composite index in different ways. So if you want to use, say, OECD methodology, or if you want to use the index of deprivation methodology or something else instead, we're providing a set of functions that will help do that, and then popping it all into a Shiny app. So you can do things like just upload a set of indicators and tell it how many domains do you want to have, where a domain is sort of a thematically grouped set of indicators. And then you can assign all the indicators in your data set to it. So my domain here of similar important things includes healthy life expectancy and number of bananas. I would argue that number of bananas is somehow related to healthy life expectancy, but do feel free to argue against me there. And then we've got lots and lots of different settings that you can use in there, and I'll spare you the nerdy details of that. But you can just go through this like quite open approach to designing how you want the index to be, and then finally saying how you want to sum everything up, and it gives you a CSV file that you can download. So this is for people that don't know how to use R. They can still make their own indices. But people who do know how to use R, you can, in the future, not now, it's not ready yet, but download the compositor package, and it will have a whole set of functions to help you do that, hopefully quickly and hopefully without many errors. Now I'll talk a bit about our work in health inequalities. So given the broad range of health services that we offer, all with the aim of trying to reduce inequalities in access to healthcare and navigating the healthcare system, we needed some way to help our health teams understand the scale of health inequalities across the UK, and particular target where we're approaching healthcare commissioners and also developing our own sort of more targeted community-based interventions by looking at three broad things. One is places where health is likely to be worse and access to healthcare is likely to be more difficult and people are at greater risk of poor health. We wanted to combine that with some stats around local health system performance, and then finally look at demographic profiles, particularly for population groups who are more at risk of being excluded from accessing healthcare or just more likely to develop certain healthcare conditions. And that involves loads and loads of data and has been something that we've really wanted to design closely with our healthcare team. So we've taken a product management approach to building this app, This is a little glimpse into our massive Miro board that shows how we've been building this out over time. It's been really nice seeing this evolve. Like, it started with the very small bits at the top that you can't really see there, and it's grown out over time to include, in the purple on the right, this is sort of our survey of the data landscape across all of the nations in the UK, to mapping out user requirements, taking user stories, doing some effort impact measurements and to help us prioritize. And so working really closely with the users of this to co-design the software in a way that is most helpful to them. But it's not just like this product that's involved in it. All these hex diagrams are other products that we're making kind of for ourselves. And so these are some of the packages that we've been developing within the Humaniverse to help us do this faster and do other work faster. And it's been really nice having some feedback from other organisations, like some people at the NHS, as well as the UK Health Security Agency, have been using our Geographer package, which helps speed up and make easy to access UK geographical data. And even some people in the NHS are using our Healthier package, which is really just taking their NHS data and tidying it up and presenting it back to them. And we've got lots more in there as well that we don't currently have little hex stickers for, but one that Matteo worked on, which is a really nice package, is called DEPARI. It stands for Digital Exclusion and Physical Access to Health Index. And it's a way of bringing together this sort of like twin threat of being excluded from healthcare, where more and more health services are becoming digital. And so people who are digitally excluded will struggle to access them. But if you also, for example, have mobility issues or you don't own a car, then you might find it harder to physically get to a healthcare appointment. And so we wanted to combine those two data sets together to help our teams really focus in on places where people might be most excluded from the health system. And now I'm going to try something very dangerous and do a live demo of the Health Inequalities Explorer, just to bring it to life a little bit. So this is an R Shiny app that we've been developing over the last few years. And we wanted it to be just as simple as possible. If you scanned the QR code on that last slide, I will warn that it's not mobile friendly yet. So this only really works on a desktop. But this is, as far as we know, the first web app where it brings together NHS data from across the 4 UK nations. Like, this is all open data, but nobody seemingly has brought it together in one place yet. And we have data at local authority level and health board level, and you can select areas depending on what you're interested in. And then this is very heavily inspired by the Office for National Stats and how they've been visualizing local area statistics. You can see at a glance where the areas you've selected are compared to the national mean and compared to every other local authority or every other health board on things like loneliness, which is another composite index we've built, left behind areas, which is someone else's composite index we use, along with deprivation, and the DEPARI one. And we've also been using the ONS's health index and looking at the different contributors to poor health, including health outcomes, social determinants of health, so the place-based factors and preventable risk factors. So our teams can see at a glance, here are the main issues going on within these areas and how it compares to other places. And we've also got a range of secondary care indicators, and we're building out more and more demographic indicators in there. But all of this is open. The app is open, the code is open, so feel free to have a look and have a play. And then the last area that I want to talk about is our work on migration and displacement. So people seeking asylum, refugees, and also people who have been trafficked into the UK. We do a lot of on-the-ground humanitarian support, providing destitution support and casework and like emotional and practical support for people. But this is also an area where we do a lot of advocacy and influencing to policymakers on. And this is a really nice project that was a close collaboration between my team and our policy and advocacy team, where we wanted to really make some strong arguments for a more effective and more efficient and a fairer asylum system. making sure that the government is upholding their obligations under international law, and also increasing the safe routes into the UK for people seeking asylum, decreasing what has become a very big backlog in processing asylum claims, leaving people kind of in limbo for a really long time, like many years in a lot of cases, and also providing sufficient support for people seeking asylum. So this is things like accommodation, but also money in order to live, because you can't work when you're waiting for an asylum claim. So this is a couple of examples of some graphs. We've taken, as much as we can, a really data journalistic approach to doing this. And this will be my second demo. This QR code will take you through to our main website, which is where you can go and see it for yourself. And this was a nice way of combining a few different technologies. So we've got R in the back end for this one, and I'll talk a bit more about how and why we've done that. But we ended up using Flourish for this, and having spent like several months using Flourish furiously to make this, I'm now a massive fan of it as a way of doing data visualization. So we set this up kind of as an interactive report, an interactive set of data stories, where we're doing some storytelling at the top here, like pulling out key statistics, but also providing interactive ways for journalists, policymakers, the public to really go through what is, in essence, a whole bunch of publicly available data sets, like pretty much everything in here, apart from one section which is on our own data about people we support. All of this is published by the Home Office, by the European Union, by UNHCR, the UN High Commissioner for Refugees, but it's all in Excel spreadsheets hosted on different websites. And so what we've done is set up a whole bunch of data infrastructure, lots of R code that helps us bring together all of these data sets and just make it open and accessible for others to use, when previously it's just quite difficult. So that means we're taking the brunt of the difficult bits of data processing, but putting it out there as a way to sort of see the state of the asylum system and help hold the government to account. So we went through many different kind of prototypes for this, and there were sort of three elements that we needed to think about when working on this. One was how we fetch and analyze the data in the first place. The other was about how we visualize it, and then third is about how we host it. And this, because this was a close collaboration with our policy team are not data experts, and this led to lots of like quite interesting conversations where we realized we were essentially speaking quite different languages. And one thing that we found when really trying to bring this kind of stuff, like this kind of decision making, to life for non-technical decision makers and particularly budget holders, is to try visualizing the options that you have. We did lots and lots of different kinds of visualizations, mock-ups, like really simple paper kind of prototypes around it. But also being very clear on the advantages and the disadvantages in non-technical language of all the approaches that we were considering, and very importantly, how much each of them cost. And that really helped the non-technical people think through what was a very complex technical project, at least for Red Cross kind of standards. And one bit that I want to talk a little bit more about is the data architecture that we decided to use for these analyses. So early doors, we set up a set of principles for this. We wanted our analyses to be repeatable, and we wanted the data ingestion and the cleaning to be as automated and frictionless as it could be. We wanted our analysis to be open, because we were, there was this phrase that people used in our teams about letting the data speak for itself. And I don't think data ever does speak for itself. There's always so much interpretation, particularly like if you're taking a Home Office spreadsheet, and even just some of the choices you make in how to turn that data into tidy data and calculate certain fields. That's not letting data speak for itself. You're doing some kind of manipulation. And so I wanted something that could be open, it could be peer-reviewed, it could be quality assured. And we wanted to make sure that the data that we're outputting is accessible as well, because we wanted journalists to be able to access this as well. And we wanted to minimize the risk of errors and misinformation. And so it will come as no surprise to you that we chose Excel. So here's what we ended up with. Lots and lots of different data sources that we then wrote loads and loads of R code for. And using our asylum package, which is part of the Humaniverse, this is sort of our core place where we're bringing lots of Home Office data sets together around the asylum system, but also the modern slavery system into one place. Some functions that we wrote for our compositor package to help us do some of the manipulation, and lots of tidyverse packages, which we then process everything and bung that all into a GitHub repo. So we've got not only the processing code for everything, but we've also got CSV files for all the outputs. And then those CSV files we feed into Flourish, and then it ends up with all the lovely data sets that we see. And this has helped us rapidly analyze asylum stats as well, so we can just really quickly build other apps that help, say, our comms and policy team with things like understanding changes to the asylum system as and when they happen every quarter. So I'm over time, but I'll just leave this little slide up for the Q&A to tug at your heartstrings, because we do need some help. I glossed over lots of details. I made it look really easy, but we do need help. So if you've got data, code, expertise, brain power, do come and talk to us.